has lifted the global gag rule that banned U.S. funding for any international health care organizations that perform abortion, advocate for, or even discuss abortion. The Mexico City policy, as it was known, banned funding, even if those activities were funded by non-U.S. money. The global gag rule was seen by many as a major global barrier to access to crucial women's health services. President Ronald Reagan imposed the gag rule in 1984. It was rescinded under Bill Clinton, but reimposed again after President George W. Bush took office. Obama signed the order to again rescind it one day after the 36th anniversary of the Roe v. Wade Supreme Court ruling that effectively legalized abortion in the United States. I'm joined right now by Marianne Malman. She's the women's rights advocate at Human Rights Watch. She has extensive field work experience on reproductive rights in the United States and abroad. We welcome you to Democracy Now!
Thanks for having me.
Can you talk about the significance of the global gag rule? Explain exactly what it did and what it means to lift it.
The global gag rule had two main effects. On the one hand, it banned organizations from providing services, essential services, for women who needed abortions or who needed care for abortions. And on the other hand, it limited significantly democratic dialogue on what is essentially a huge public health issue in a number of countries, in particular in developing countries. So it really had an effect both in terms of services, and then it had an effect in terms of how the society was able to deal with these issues.
But explain how the gag rule was imposed. You have an organization in another country. What are they allowed to do? What are they not allowed to do?
Well, actually, the global gag rule is much more limited than the manner in which it was imposed. So we have a situation of a sort of Chinese whispers or Chinese telephone that doesn't work, where you have a very staunch anti-choice dialogue or discourse coming out of D.C. that everybody hears. And then you have a gag rule that basically gags you from dealing with abortion as a so-called family planning method, but not abortion after rape and not abortion where it would save the life of the pregnant woman. It also doesn't impose any gagging on post-abortion care. But all of this doesn't reach the organization who's actually providing the services. What they hear is what Washington is saying, and then there are grantees and sub-grantees all the way down, and these very intricate rules have to be explained, and often they're not. And so you find a situation of self-gagging, in fact, where organizations will not provide services that they could have provided because all they hear is, by the end of the year, you may have to give back a large amount of your funding if you even as much as whisper abortion. And that is the worst effect it had, this self-gagging, this over-imposure.
We're also joined on the telephone from Nairobi, Kenya, by Dr. Sarah Onyango. She's director of the Africa Regional Program for the Planned Parenthood Federation of America. Dr. Onyango, welcome to Democracy Now! It's interesting that the man whose father was born in Kenya, Barack Obama, when he becomes president of the United States, one of his first acts in office was to lift this global gag rule. Your response and how it affected you and your clinic.
I hope you can hear me well, and thank you very much for inviting me to take part on this program. We here in Kenya, especially those working in the field of reproductive health and rights, are very excited about the reversal of the global gag rule, because the global gag rule has had significant negative effects on general access to sexual and reproductive health information and services, resulting in negative consequences for women in our region, both in Kenya and the African region. So we're very excited about this reversal and see it as a step forward to improving the lives of women, especially as it relates to sexual and reproductive health issues.
Now, you had clinics in Kenya that chose to close rather than abide by the gag rule?
My line is so bad. Could you just repeat that again?
You had clinics in Kenya that chose to close rather than abide by the gag rule?
Yes, we did. The two main organizations that two major organizations that signed against the Global Gag Rule were the Family Planning Association of Kenya. It's the IPPF affiliate in Kenya, and Marie Stopes International. Both the two organizations were previously very large beneficiaries of USAID funding. And following the Mexico City policy, they lost up to 50% of their resources. And the direct effect was that they had to close several of their clinics and reduce the services they were providing. And so really reducing the access for services for many women that depended on these two organizations for care.
How did that affect family planning in Kenya?
It affected family planning very significantly. Family planning in Kenya was started in the late 70s, and since the time family planning was taken up as a national policy, Kenya was one of the countries that really showed a progressive increase in uptake of family planning, with the contraceptive prevalence rates going up steadily from the late 70s to, towards the end of the 80s and the 90s. And in around 1989, 2003, the contraceptive prevalence rate had reached 39% and was one of the highest in Africa. However, and this was because of the role that was played mainly through community-based distribution of contraceptives. And Family Planning Association of Kenya was one of the organizations that led the community-based family planning service delivery here in Kenya. And so when they cut down their services,